Now, still on this story, unemployed doctors in KwaZulu-Natal say austerity measures are putting lives at risk. They say staff shortages at hospitals will lead to overworked doctors and nurses making mistakes. Medical professionals say there shouldn't be shortages as thousands of doctors are jobless. eNCA also reported that Ngwelezane Hospital in Empangeni is falling apart with patients being turned away. KwaZulu-Natal Health Department's HOD Sandile Tshabalala joins us now to discuss all of this. Mr. Tshabalala, good morning and thank you very much for your time. Just perhaps if we start with Ngwelezane Hospital, why exactly is it in such a state?
I am disappointed to hear that there is an assertion that the hospital is falling apart, more so because we started a program of building that hospital. I knew you'll remember this is an old hospital, for which we've been having a project of improving its outlook, but also its efficiency and effectiveness in terms of the patient care. What has happened, however, is that we had a contractor who, when he was supposed to finish the work, he could not. And we started to charge this contractor for the delays that was in the contract, until we realized that the contractor is actually failing to come on board in terms of finishing the work given to him. We have since given this work to another contractor, particularly to prioritize the fixing of what is called the HVACs, which is the system that cools the facility, particularly the theaters. That work has been authorized by myself, and the contractor is in the hospital, so we're trying to resolve that. So that is why I'm saying I'm disappointed. So we're working on it. We appreciate, however, the fact that there are delays.
So meaning it's not necessarily disappointment that perhaps you're denying that there is an issue. You do know that there is indeed an issue at Ngwelezane, but you're working on it. Now, to the other problem of the shortage of doctors, we understand that at this point, the patient ratio is 1 to 3,000, whereas it should be 1 to 1,000 as per the World Health Organization. I mean, surely this is untenable. What is the plan and why is it the situation?
Allow me to speak to the shortage of staff generally, or all categories of staff in our facilities. And I think the minister, the MEC in the province has said that we are agreeing with the staff generally and the community that there is this shortage, not only of doctors, but of different categories of staff. And it is for that reason that when we want to fill our posts, we want to rationalize and fill posts firstly where we need posts, rural areas being among those that we want to prioritize. But also, let's make an example between you and I, Sis Nomfundo. You are a doctor, you have to operate in a theater, and there is no cleaner in the theater. You end up being the doctor, the cleaner, the nurse, and everything. So when we have to fill these posts, we then need to look at all these categories of staff, but also look at where do we want to fill them. Thirdly, look at the resources. The aim is not to have a big head count, but the aim is to have an efficient system. So that is how we're looking at it.
But at this point, if one thinks about it, if you've got one doctor seeing to 3,000 patients, they're doing 3 times the work. That means throughout the day, there could be a situation where that doctor could make mistakes. And that's why it wouldn't be an exaggeration by some of those unemployed doctors to say that lives are now at risk, because the potential of making mistakes is quite greater if you're doing 3 times the job you should be doing.
What we agree on, Nomfundo, is that we do have a shortage of all categories of staff. What we do agree on is that if during the process of seeing an individual patient, you want to rush through that patient, then mistakes will be done. But also what we try to do is to say, how do we allocate the available staff such that the elements of exhaustion are done away with? And those are means and ways of trying to say, while we don't have all the necessary resources to employ the doctors, nurses, cleaners, security, and all the other categories, how do we manage the available resources? So we are pleading that we need to work with all these categories of staff to say the service that is required by the people of our province needs to be looked at, and the available resources need also to be considered. And we then say, in partnership, how do we move in solving this challenge?
But here you've got the doctors, they've already taken to the streets, meaning that whatever plan you had to rationalize, it's not working. It's not working for them. They're saying they're burning out and they are making those mistakes. So is there any other option? Because if you're saying you've got budgetary constraints, is there any other way to speak to National to somehow assist in this respect?
Now, that is why I keep going back to all categories, because if you were to do your own survey of how many nurses are unemployed, you would see another big picture as well. But at the same time, yes, the minister is dealing with the matter. The MEC and the other MECs in the country are dealing with this matter. And all that we have to get is in the next few days, few months, what is going to be the situation in terms of available resources. Remember, resources are not only money, but it's also other equipment that they need to work with. So all that need to be taken into consideration.
And we honestly do understand that it's not just the doctors, like you say, it's nurses, it's cleaners that are also needed. But today, when we've got doctors who are protesting yesterday, then we sort of make it the focus at the very least that you've got here at least 400 doctors that are unemployed. Many had thought this was the preferred career, you'd automatically be placed. They're finished with their community service, but they cannot be placed because posts exist, but there's no budget.
I would want to leave that question so that it is answered correctly at a national level. Remember, you are talking of a challenge that is not only facing KwaZulu-Natal, but it's facing the whole country. And among the doctors that you are talking about are doctors qualified outside South Africa, and they have also to be dealt with by HPCSA. So there are other stakeholders that have to come into play for us to say, how do we manage this case? And as long as the minister and all the other principals are dealing with this matter, we have to then say, how do we speed that process up? And then how do we employ these doctors who qualify to be employed and allocate them in the areas that we need doctors at? So definitely that is being worked on at the moment.